today we will talk postnatal care. So, you with introduction. So, first, what do you mean by postnatal? The name itself suggests post means after. Okay, so postnatal period is the period following delivery during which the new mother's body begins to recover and returns to normal. Most of mothers are home within 48 hours and the physiotherapy session should be attended within first 6 weeks. The time taken to return to fitness after childbirth will vary according to the lifestyle beforehand and the type of delivery. So, for example, it takes longer to recover from a caesarean section than from an uncomplicated delivery. And the fitter the woman beforehand, the quicker is the return to normality. Emotionally, the woman is affected by the bodily changes and by her new responsibility. The parenthood creates a new dimension which is difficult to imagine, and the feeling of responsibility can be almost overwhelming. So, aims of the physiotherapy. What is the importance of physiotherapy in the postnatal care? Okay, so first is re-educate and strengthen the pelvic floor muscles. Second, instruct in the care of perineum. Third, relieve pain in the perineum. Fourth, strengthen the abdominal muscles. Fifth, give post-operative care following a caesarean section. Sixth, advice on posture and prevention of back strain with activities related to the baby. And last one, give instruction in a long-term exercise that is 6 weeks to 6 months. Pelvic floor muscle exercise. So it is most important in postnatal care, that is strengthen the pelvic floor muscle. So start pelvic floor muscle exercise within 6 hours of the delivery to regain the strength of this stretch muscle as soon as possible. So the contraction may be felt only around the anus because the perineum is numb, but the antenatal practice help as the mother knows what to aim for, and that's why the therapist needs to encourage the pregnant lady mother for 4 times 4 to 5 times at a frequent intervals throughout the day. After that, the therapist suggests to the mother try to arrest urine mid flow, and after that, that is the progression of that pelvic floor muscle exercise increased up to 50 per day in a small group of 5 at a time and linked to a daily activity. For example, when washing the hands, mother can be doing this pelvic floor exercise. Second, getting out of the chair and feeding of the baby. So it is the progression of that pelvic floor muscle exercise. Sometimes the mother may be afraid to try because of the post-delivery discharge. It's called lochia, and because of stitches or the pain. That's why the therapist helps to explain that exercise will increase the circulation and promoting the healing and removing the inflammatory exudate, which will in turn relieve the pain. So it is most important to strengthen the pelvic floor muscles. You can see in the picture that the lady doing the pelvic floor exercise. At the 6th week, the postnatal appointment, the obstetrician will check the perineum of for the healing, the perineum is healed or not, the vaginal opening for size, and the cervix for erosions, and the muscles for the strength. If on testing at 12 to 6 weeks for stress incontinence, It is generally present after delivery, stress incontinence. There is a problem. So the mother is referred for outpatient physiotherapy. The lady who is suffering from the stress incontinence, mostly the doctor suggests to the if for the physiotherapy. So it is most important for the stress incontinence. Okay. So for that, what to do in stress incontinence by physiotherapist? First is the interferential therapy, that is IFT, pelvic floor exercise. It is most important in the stress incontinence, IFT and the pelvic floor exercise. Okay. There is a one test for to check the stress incontinence, that is try jumping up and down 2 to 3 hours after passing urine and coughing at the same time to raise the intra-abdominal pressure. So it is checked by the physiotherapist. One test is available. So physiotherapist can check the stress incontinence. If stress incontinence is present, so IFT and the pelvic floor exercise can be done. Second is the care of the perineum. Okay, for that, frequent bathing, changing of the sanitary pads should be required. The area should be kept dry and during a bowel movement supported with the clean folded sanitary towel. So by doing this, the care of the perineum is done. Relief of perineal pain is there. So after postnatal, there is a pain at the perineal area. So how will you prevent that pain or the relieve that pain? So first is, after that the lady should be sitting on a ring cushion or between folded pillows. Ring cushions or between folded pillows. Why? Because pressure on the perineum is relieved by doing this activity. Second is side sitting or the side lying. Why? Because of uh, due, it is comfortable for the breastfeeding. Third is prone lying with the pillows under the lower legs and the abdominal to relieve pressure on the breast may be restful. Sometimes mild sedation may be helpful. The bruising is absorbed, the quicker healing takes place, and the pain is relieved. Ice. There are two methods to apply ice. One is the ice pack and second is the ice cube. So as a ice pack for 5 pain minutes, 4 to 5 minutes, or the ice cube wrapped in a wet swab, move gently over that area for 2 to 3 minutes twice a day, and this method can be carried out at home by the mother itself or the herself. Pulse electromagnetic energy, that is PEME, can be applied to that area at a low intensity for 5 to 10 minutes to promote the healing. And ultrasound may be applied underwater with the mother in a bath if at the later stage there is a dyspareunia like pain on the sexual intercourse. So why it is important? The scar tissue around the vagina can be softened by the effects of the ultrasound. So it is most important is ice, PEME, ultrasound. So it is mostly important or the therapeutic modalities by physiotherapist. Next one is strengthening of the abdominal muscles. Immediately after the birth, the muscles are slack and the intra-abdominal pressure is reduced. At first, the uterus remains above the pelvic rim and the woman is concerned about looking for 5 months pregnant. Involutions of the uterus means involution means it is the like a process. After it is the process, the uterus is pregnant to the non-pregnant stage. It is known as the involution of the uterus. It is generally completed in about 14 days. But the abdominal muscles may take 6 weeks to return to the pre-pregnant state, and it can be 6 months before full strength is returned. Next one is care of the back is must explained by the physiotherapist. For example, the rolling onto the side to get in and out of the bed, avoiding the straight sit-ups, lifting is already taught because the normal support of the true abdominal for the lumbar spine is diminished and the ligamentous laxity still present renders the spinal structures more vulnerable to the strain. So care of the back is must explain to the mother by the physiotherapist. It is most important diastasis of the rectus abdominis. What do you mean by diastasis of the rectus abdominis? That is the separation of two muscles should be monitored. Means separation of two muscles. You can see in the picture. Okay, this is the normal abdominal and you can see here the diastasis recti. So here it is the normal abdominal. This two rectus abdominis is there. Okay, and this one is the transverse abdominis and the obliquus, internal oblique and the external oblique. So this is the normal abdominal. Okay, and here you can see here between gap is there. Okay, it is known as the separation of two rectus abdominis and the gap is present. The woman lies in the crook line with the lumbar spine flattened and the head is lifted to produce abdominal contraction and the gap is felt with the finger just below the umbilicus between the internal borders of the two muscles. So here you can feel the gap between them. At first, the muscles are 2 finger breadth apart, but 6 weeks the gap should be reduced so that only the tip of the one finger may be inserted. If the gap is greater, like a 6 to 4 fingers breadth, then the rotations and the side flexion should be avoided and the straight abdominal muscles work only is recommended until the gap is narrowed to 2 finger breadths. Diastasis is more common in women who have several pregnancy, obese and prone to bronchitis. So if multiple pregnancy are present in that part, the diastasis rectus are present generally. Strengthening of the exercise of the abdominal muscles, like how will you performing the strengthening exercise of the abdominal muscle? First, there are several methods to strengthen that muscle. So first you can see in the picture like the in the crook lady is in the crook line and pelvic tilting is there. So it is our first exercise to strengthen the abdominal muscles. Second is the like some modification is present in that line. So crook line, back flattening, hold to count 4 and rest progress to holding for a 10. Third is crook line, back flattening and keeping the back flat and slide the heel slowly down the bed and slide slowly back. Fourth one is crook line. Tighten the abdominal muscles, lift the head and the shoulders and lower slowly. Fifth one, half crook line, hip hiking on the side of the straight leg. Sixth one, sitting trunk bending side to side. 7. Crook line, the knees rolling from side to side. 8. Sitting trunk turning from side to side. 9th, to work the hip extension which help to maintain the backward and the forward pelvic tilt. 10th, prone line, alternate leg raising and the lower leg. 11th, prone line, tighten the buttocks and hold for a 10 count and rest. So these are the exercise to strengthen the abdominal muscles. It is most important to remember that the abdominal muscles should be contracted and released slowly at first, and jerking must be avoided. So it is most important, jerking must be avoided. Physiotherapy following caesarean section. Sometimes C-section, that is the caesarean section is present. So what are the physiotherapy for the caesarean section? You can, at a first day, breathing exercise. Okay, you can see in the picture the lady performing the breathing exercise, like a deep breathing exercise, and you can perform the Lama's breathing in caesarean section also, in the normal delivery also. Second is the huffing with a pillow held over the wound. Third is foot and the leg exercise are performed to assist the circulations. Teach the mother how to move about and to roll on side to side for getting in and out of the bed. Feeding the baby in bed, have a pillow under the thighs to prevent sliding down, and the extra pillow under the knee on the side of the feeding. So this is the precautions while if the cesarean section is there at the first day by guidelines by the physiotherapist. In the second day, at pelvic floor exercise. So you can see in the picture the lady performing the pelvic floor exercise. Second is straight abdominal exercise. Third is pelvic tilting, like in a lady is a crook line positions, and tilt your pelvis up and gradually slower down. Fourth is continued deep breathing exercise. Fifth one is the standing stretch tall or the tighten the buttocks. You can see in the pictures. Walk tall to prevent backache. If possible, walk straight. Subsequent days, first is progress exercise along with the same lines as for vaginal delivery. Vaginal delivery means with the normal delivery. Second is stitches are generally out by 7 days, and the abdominal contraction are very important to maintain mobility and of the healing tissue. Abdominal contraction are very important to maintain mobility of the healing tissue as well as increasing circulation to promote the healing. Involution of the uterus is slower following a C-section. The mother may be attended classes after discharge from the hospital. Advice on activities related to the baby. First is feeding the baby. Okay, so a variety of positions can be tried. First is the sitting in bed, back supported, bend the hip and knee on the side the baby is feeding, and side sitting can be tried. So these are the variety of positions So you can the mother can be choose anyone while feeding the baby. Sitting on a chair, back supported, and supported one foot on a stool on the side the baby is feeding. You can see in the pictures, like while sitting, the baby or the mother should be in a comfortable position. Mother should be in a supported position. Third is sitting tailor position may be used with the back supported. Fourth one is side lying in bed can be used, but it is not easy for the first time mothers. Checking the suitable height when the bathing or the changing the baby, arrange an easily accessible height, and stooping must be avoided. Kneel down instead. So you can see in this picture in the side line in bed while feeding the baby. Carrying the baby. How will you carry the baby while mother should be in a comfortable and back supported? So baby should be close to the body of mother for the security and well-being of both mother and the baby. Second is over the shoulder is the natural position for the carrying. And last one is holding the baby on one hip for too long can cause a strain on the back. So how will you hold or the carry the baby? So it is most important for the mother. There are various classes to attend by the mother. So class 2 is, first is abdominal strength is assessed in class 2. Diastasis of the rectus abdominis muscle should be checked. Exercise are progressed. Pelvic floor muscle function is considered in relation to stopping urine flow in midstream. Ability to relax is ascertained so that the mother can regain energy when the baby is asleep. This is especially useful for the mother whose baby is keeping her awake for a large parts of the night. So in the part, relaxation is most important for that mothers. In the class 3, posture, back care, lifting are checked. The importance of this emphasized in long term to reduce the incidence of sacroiliac and the spinal joint strain. If there is a pain of musculoskeletal origin, the appropriate treatment should be implemented to prevent the disorder becoming a chronic. So in the class 3, all months it is checked by the physiotherapist, and posture, back, lifting should be checked, how the mother lift the baby, carrying the baby likewise. And if is there any problem regarding the musculoskeletal origin, the treatment must be implemented. For the continuation classes, the exercise regimen should be continued and progress to enable the mother to retain her normal activities, including the yoga, sports, in a fit condition and with the safety. Leisure centers, so postnatal sessions and the aqua exercise group will continue in that the research centers. The mothers pay a small fee for a series of about 6 sessions, and this contribute to the overall fitness of the mother. As such, they constitute an important aspect of the health care. Hydrotherapy is of a special value in providing a medium of weight of relief of strengthening of the abdominal and the pelvic floor muscles, as well as swimming for the general fitness. So aqua exercise groups and the hydrotherapy for the strengthening of the abdominal muscles and the pelvic floor muscles, and as a general fitness for hydrotherapy is useful. Lifting, the antenatal education on back care and the lifting and practicing the physiological relaxation. So while you're lifting the baby and all that conditions or the weight, so antenatal education is required regarding on back and the lifting, and most important to relaxation. Postnatal exercise from 6 weeks to 6 months. So it is important that the mother can fit exercise into a busy day, that she can combine her own program with baby play. For exercise in crook line, the baby can lie prone on the mother's tummy and the chest. So mother's back should be in rest position. So it is easier, and it's the combined activity like for baby and the mother. During exercise in prone kneeling, the baby can lie between the mother's arm. Some suitable exercise are back humping and the hauling. It is known as the cat and camel exercise. Pelvic swinging from side to side. Alternate leg stretches backwards with the abdominal contraction. Another is in standing, the baby can held within the arms and the mother bends and stretches the knees and hip with her back against a wall. So mother's back should be in a comfortable, and the don't strain on the mother's back. Some suggested plan for the postnatal management is: class 1 should be about 6 weeks after discharge from hospital, and the other two at the 2 to 3 week intervals. Class outline, that is, exercise are checked for timing and quality of movements, retaught as necessary, and the progress. Postural advice is reinforced, questions are answered, group discussion is encouraged to provide holding, means group discussion is encouraged. Okay, so thank you so much for listening carefully with the postnatal care.